Hi, everybody. I'm Dr. Ron Vender. I'm a dermatologist in Hamilton, Ontario, Canada. And welcome to this IPC Take 10 short video where over the next 10 minutes or less, I'm going to tell you how to increase the efficiency of your office or your EMR. So we're going to share a screen. We're going to look at a fake patient, so we don't have any confidentiality. And hopefully you'll see how to adjust your EMR if you have the ability to do this in order to run your office a bit more efficiently with respect to the psoriasis patients. So let's do a share screen. And this is Minnie Mouse, who is a patient of mine. And you can see here, there's a listing of the visits on the left side. In the center here, you see some enrollment forms. But the main part of this that I want to show you is mostly these panels to the right here. And basically what I have here is a listing of next visits notes. So these are little reminders so that maybe you took pictures, so you can add pictures to do. So that's one thing that you can add in the corners that'll remind you. This EMR has something here in the patient's part that will pop up globally that will say take pictures. So that's sort of like a reminder. You update the patient, and every time that you touch the patient, it will come up. So there is that as a reminder. The other thing that I really think is important, besides surgical medical history and allergies or something, is a biologic screening. So if you create a tab on your right side here, you can see that I call this a biologic screening. And let's just say they had blood work done and they were found to have high liver function tests. I make a note of it. I put today's date, which happens to be September 19th, 2022, after the EADV. And then I press save and close. So that knows that I had the blood work, but they had high liver function test. Here we can also add CT scan results and show that maybe there was a granuloma that was there. We can put a date there. We can save a new. I can put here that, for example, they had quantiferon, which was, let's say, negative. So then I know that they were negative, and I put the date. And so what I will do is I'll quickly look on the right side and see the screening that the CT scan, they had granuloma, chest x-ray, they had a granuloma. But I know that the quantiferon is negative, the TB test was negative, and so forth. Here's a previous chest x-ray from a few years ago, so there's been a change. So keeping these biologic screenings will allow you to very quickly see in your screening procedures what has been done. So let's just say somebody calls and says, is this person ready to start? And you don't have a quantiferon or TB test back, then you'll know right away. The previous treatments is also very important. Maybe they were on acitretin and then they failed. They failed, and you can write secondary failure there, and then you can add today's date for that. You may want to put cyclosporin, and then you have cyclosporin, and then you would write contraindicated due to renal disease, let's say. So you can put that as well. And the other thing is maybe that they were using topical treatments such as vitamin D derivatives or topical steroids or other types of drugs as well. So that will help you to determine whether they would qualify or whether it's time for them to move on to biologic. The other band that I have is a PASI band. And so I can write today's date and say that their PASI, their BSA was 12. And I put today's date. I do a save and a new. I put their DLQI. Happened to be, let's say, 14, and a save and new, their PASI, let's say, was, when I calculated, it was 18, and save and new, and then their PGA is, if I write PGA, let's say their PGA was very, very bad, or 3, let's just say, and then I can do save and close. And it wants me to select the history. So I have to say PGA 3, save and close. And so here you can see we have the BSA, the PGA, and the BSA. Back in 2019, they were 0. And then also prior to that, their PASI was 6, their BSA was 6. So I could see a trend of what's going on. A previous biologic use list is also good to have. So maybe they were on, we can see here that they were on adalimumab before. It's possible that they were on ustekinumab, and then we can write a dose of every 8 weeks that they were on in the past. So we can add that to the list. Maybe their insurance provider. So here in Canada, we have Manulife. But they may be public reinsurance. So I can add a specific type of thing and write public here, say okay, and then close this, and then type in public. And now it's a choice, and I can save and close. So immediately I'm going to know if they have a private insurance. I have a list also for clinical trials that they've been in. So here's are some of the Novartis clinical trials, the Janssen clinical trials, the AbbVie clinical trials, UCB clinical trials, all the clinical trials that I've done. And then maybe they were on this clinical trial, UCB 2015, and they were on it, let's just say, then from 2020 to 2022, they just stopped. And then I know that that's what it is as well. If I want to edit it, I can go to this, and I could also put in the note that that was for bimekizumab. So I can do that and remember that that's what that study was. I have little bands for vaccines and whether they were COVID-19 positive in the past. So all of this is important when trying to be efficient. And if another doctor comes into the office, at least they don't have to look through your charts and see what the PASI was, see what previous biologic that they were on, see that they did their testing. Everything is right there. So a lot of family physicians will have special lists of skin cancers or past medical history like hypertension, hyperlipidemia, diabetes and stuff. You have the option for that as well. And a surgical history, for example, here, I can add that the patient has had diabetes, and I could say maybe they had it since 2018. And then I would look, and then there's their diabetes 2018. So it simplifies things. It shows that you're keeping track of what's going on. If they're on methotrexate and you calculate the dosage, you can keep track of the methotrexate dosage. You can create its own special band for that or section. So every EMR should have this capability. This is a common EMR that's used in Canada, but really the basics for them are all the same. And I just thought that that would be interesting to share, to when you're following your psoriasis patients and you want to switch, you know they had their chest x-ray or their quantiferon that was done and when it was done, you know how much methotrexate they've taken, you know their past medical history, you know what clinical trials that they've been in, you know their previous PASI, their BSA. Yes, it's a lot of work, but you can also train administrative and ancillary health staff to put this for you. So for example, you may want to create a task, and then I will tell my task, I will say, add that the patient had a stroke in 2019, and then my staff will know to put that in there and say, yes, okay, that as part of the medical history, or if there's a long list of medications as well, if you're checking for drug interactions. So anyway, I hope that this is worthwhile for you. I think it is. It makes my office run very, very efficient. It stops having to look through. We used to look through papers, but looking through the computer or even doing a search for a specific keyword. And I hope that this has helped you. I wish you all a great and efficient day so that you can run things very, very smoothly and keep things at a minimum of effort so that you can run your clinics on time and you can maybe have some free time for yourself. With that, I'm Dr. Ron Vender, International Psoriasis Council counselor from Hamilton, Ontario, Canada. And I hope you enjoy this short Take 10 video. Have a good day. Bye-bye.